want you to make some funny sounds. I want you to go la 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 la.
La 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 la.
Okay, now I want you to go ka 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 ka.
Ka 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 ka.
Now you're going to join both sounds together and you're going to go ka ka la 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 ka 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 la la la.
Ka ka la 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 ka ka la la la.
Okay, very good. And you're looking for the quality and the motion of the tongue. Okay, next part of the oral exam will be looking at the child's hard palate. Okay, once again, I want you to open your mouth and be very, very wide. So you're going to be looking at the roof of the mouth, looking to see if there's any clefting, any appearance of any surgery repairs, and you're going to have the child stick out their tongue and say ah. So you can actually examine the back of the throat, see if there's any, okay, go ahead, stick out your tongue, ah, open wide, and you want to look at the uvula. You want to see if the uvula is normal in shape and size, or if it's actually bifid. Okay, very good. And also, are there any dentures or prostheses inside of the mouth, or obturators or palatial lifts? Open your mouth again. You're also looking at the appearance of the soft palate. See if there's any surgeries. See if there's any lesions, any sores, anything that could be causing problems with the child having speech. Okay, and see if the velum and the soft palate are symmetrical. You can close your mouth for me. Okay. And then as you're going along, you want to go ahead and note anything if it's abnormal. Another important thing, you want to look at the length of the velum to see if it does have, when the child, open your mouth, when the child is making sound, you want to see if it is appropriate in length and if it has the appropriate lift to make sure that there is adequate closure of the velopharyngeal port. Okay, very good. Doesn't look like there's any structural problems there. Okay, you can close your mouth. Okay. We had the child say ah, so you could visualize the back of the throat, and you could also see if the structures, part of the velum, the hard palate, were intact and if they moved appropriately. Okay, and when you're doing the oral exam, you also, like I said, you want to look at the teeth, see if there's any missing teeth, if there's any evidence of cavities, or if there's any swelling. Now, you want the child to bite down, and you want them to separate the lips so you can see the bite. Okay, I want you to go ahead and put this here. Very good. I want you to bite down. And you want to look at the molar occlusion relationship, and you want to look at the actual bite of the child to see if there is either what's known as an overbite, an overjet, or some type of malocclusion. Okay, and by doing this, you have the child spread their lips, and you're able to observe. And you're also looking at the strength of the bite. Okay, I want you to go ahead and tap like this. Very good. Okay, very good. You're doing really, really good. Okay, you don't seem to have any problems there. Looks like normal occlusion. Okay. And as you can see, the student has very, very good oral hygiene. There are no missing teeth, no evidence of caries, and the bite appears to be appropriate. Now, the next part of the exam is to examine the diakinetic syllable rate. Once again, you have your information collected from your student, the student's name, the date of birth, okay, the teacher, the grade, who referred the student, and the reason for the referral, as well as the date of exam. Okay, now we've taken our gloves off. We once again wash our hands very well. Okay, make sure we dry them, and we discard any waste that was used for this examination.